This segment of Delmarva Life is brought to you by TidalHealth.
You're cutting vegetables and the knife slips and gets your finger.
Your little one wakes up in the middle of the night with a cough and a fever.
You're raking the leaves and your chest feels tight. You know, you need medical care, but where do you go? You don't really know.
So do you wait for the primary care physician? Do you visit the immediate care? Do you call an ambulance? Do you just hightail it straight to the emergency department? Well, we would like to introduce to you someone this afternoon who has the answers to those questions and more. This is Tanya Robinson. She's the provider at TidalHealth Immediate Care. Thank you for joining us this afternoon.
Thank you for having me.
So these are some questions I'm sure you face all the time, right? Mm-hmm. So let me ask you first, kind of as a preface to what we're talking about. What's the difference between your primary care physician and your immediate care and the hospital's emergency department?
So with those three arenas, you may see a provider that is either a physician, a nurse practitioner, or a physician's assistant. However, you would attend or go to your primary care office for things such as your day-to-day comprehensive medical treatment.
Okay.
And you would see me at the immediate care for things such as an acute situation, minor non-life-threatening events or illnesses. And then of course you would go to the emergency room for things such as life-threatening events, traumas, or even a situation that may warrant further urgent evaluation.
Okay.
Okay, so you work in immediate care. How long have you been seeing patients?
So I've worked in immediate care for going on 6.5 years now. However, I have worked in healthcare for 27 years.
Wow. Okay, so if I understand correctly what you just explained to me, you're kind of like the middle ground. I don't need to wait for my doctor, but it's not something that has to be done right now. Can you be a little more specific with me about what kind of injuries or health care you provide?
So at the immediate care, so for example, if you sprained your ankle, you're not sure if it's broken or not, and you want it to be evaluated, you can't get into your primary care doctor, you can come see me. You wake up, you have a sore throat, I'm not sure if it's strep or if it's a common cold, you would come see us at the immediate care.
Yeah, and now with, of course, going through the pandemic, we have been discouraged to go from going to the emergency department unless, you know, it's an emergency, and go to the immediate care. But when is it appropriate to go to the emergency department versus calling 911?
So definitely call 911 if you're experiencing chest pain, palpitations, those type of situations, and or any stroke-like symptoms. Don't hesitate, call 911, do not drive yourself. Emergency rooms would be instances where you would actually maybe get someone to drive you to the emergency room. Would be, say you have a history of congestive heart failure and you have an increase in shortness of breath, difficulty breathing, can't get in to see your primary care doctor. However, this would be a situation where it would warrant urgent evaluation. So that would be a situation where you would perhaps get someone to take you to the emergency room.
Okay. So what kind of preparation should we do, whether we're going to our primary care or to come see you or going to the emergency department? What should we have ready?
Okay, so first of all, please have your photo identification and any type of insurance card if applicable. Sometimes people think that it's in the system and these things may not be in the system.
Right.
Also have a list of your current medications, any known allergies, and going back to the medications, even things such as supplements, that's very pertinent because this is information that myself or whomever as the provider, we actually use that information also when we formulate a plan of care for you.
So you have more than one location for
That is correct. So we have two locations. One is in the Laurel office right on the highway, and one is in Seaford right in the Muir Center.
Tanya Robinson's with TidalHealth. Thank you so much.
Thank you.